I know that there is a lot of things that you need to take care. It's difficult sometimes to deal with a diagnosis. And sometimes, of course, the first thing that is going to the last role is the oral hygiene in many cases. But we are going to learn in this presentation the importance of being in compliance with oral health. So the first thing that we are going to know is that when you get the diagnosis, the first thing that you need to have is a detailed evaluation of all the tissues. In the oral cavity, we not only have the teeth, we have also a lot of tissues that are soft and also hard. So we have to be able to check that we don't have any disease in the mucosa or the gums, in the teeth, many cavities, that the bone is good, because when we have gum disease, the first thing that affects, not only the gums are affected, but the bone also is going to be suffering. So we want to prevent all of that. The TMJ also is very important, and all the muscles that are in the masticatory area, because depending on the location of the treatment and some of the chemotherapeutics that you are going to have, they may affect also the bones, the muscles. The saliva is another factor that may decrease, especially if the salivary glands are going to be affected for any of these, again, the radiation, depending on the area that you have the cancer or the chemotherapeutics. And one of the most common side effects that you may have from the treatment is going to be, there are going to be the mucositis, but also if you have dry mouth, you are going to be more prompt to develop decay or gum disease. And we need to try to avoid that, those symptoms, so that those diseases, so that you can have a recovery that is more, that is easier and less complicated. And we are going to see, and the key for this is something that is so simple, but you just have to dedicate the time to that. So usually we divided the treatment before, as I mentioned, during the treatment. Again, the most common condition that you may develop is the mucositis, but we also need to know how we are going to keep the oral health post-treatment. So before we start the treatment, it's very important that you have the consult with your oncologist, and when you go to the dentist and the oncologist may have to communicate, because when we do the thorough exam, we also need some information from the oncologist. For instance, we need to know what type of cancer you have, how are your labs. We need a recent labs from, especially we need a CBC with differential. We need to know if you are going to have chemotherapy and what is going to be the medication that you are going to have. If you are going to have radiation, we also need to know the amount of radiation and the location of the radiation, so that we can provide better education. Identify the potential problems, because we don't want any treatment to be exacerbated during your chemotherapy or radiation therapy. You are already dealing with enough problems, and something that can be very simple fixed before you start chemotherapy or radiation therapy can become very painful and complicated if we don't do it before. We want to assess your oral hygiene also. We want to make sure that you are doing the best job that you can. Doing oral hygiene when you have pain, or when you are depressed, or you don't have any energy, is more difficult. So we want to make sure that before you start everything, you master that oral hygiene and you have excellent, not good, like I tell my patient, but you must have excellent oral hygiene. Nutritional counseling also is important because there are certain foods that are going to cause inflammation. They are also having a high content of sugar, or the acidity of those products may affect also your oral hygiene or your overall health. Smoking, we need to do a smoking cessation if it's possible, or alcohol intake as well. There are some drugs that are going to provide side effects, so we need to be aware of those as well, and treat infection and irritants in your oral cavity. If you have a resolution, like what we call periapical pathology, that means that maybe the nerve is suffering and you have a lesion that is usually, those lesions are only visible in x-rays. So that's why it's important that when you have your comprehensive exam, you also need to have x-rays, because sometimes caries are not painful, but we can detect them in the x-rays. Same thing with the periapical lesions, and if they are more than 5 millimeters, they must be treated. If you are using ortho appliance or you are replacing missing teeth, we need to make sure that they are properly fitting, so that you are not having any roughness in this appliance, because sometimes that frequent friction with the mucosa may cause ulcers, and that could be more damaging. So we need to make sure that your appliances are very well fitted. We also don't want you to have any sharp edges, meaning that if you have any broken tooth or any broken restoration, we may smooth those areas, either replacing the restoration or smoothing the edges of that tooth. And if you need extractions, it's better that we do those before you start the treatment, so that we can avoid future problems. And please feel free to interrupt. If you have any questions, just raise your hand and I'll be happy to answer your questions as we go through the presentation. There are 3 different categories that they divide the dental evaluation and treatment protocols. My personal opinion is that the complete protocol is better, because, again, from my experience with people who, for some reason, they have to start treatment immediately and they are not able to complete the treatment, sometimes things complicate. So if time allows, I am always in preference of completing the treatment before you start the chemotherapy or radiation therapy, because that is going to save you a lot of problems in the future. The partial protocol indicates that they treat only teeth that have a periapical lesion greater than 5 millimeters, or if they have, and to do extractions, they only extract teeth that have a pocket of above 8 millimeters. The pocket is, when you go to the dentist and we start measuring every single area in your tooth, in the vocal area and the lingual area. That's when if the pockets are more than 8 millimeters, the tooth needs to be extracted. Usually the pockets, ideally you don't have any pockets, or if you have, they are between 1 and 3 millimeters is what we consider normal. There is also the the protocol that consider minimal protocol, that it's if patients are treated only if they have any symptoms or pain. I disagree with that. Like I explained, I prefer to have a thorough evaluation, but everything is depending on the time. Unfortunately, probably you have this experience. A lot of the clinics that manage patients that are medically compromised are overwhelmed, and most of them have a waiting list, and that's one of the factors that we have against a complete protocol, because we in our clinic, in a special patients clinic, we don't have a waiting list for cancer patients, but there are other clinics but for patients that are not cancer patients, we have a 2 years waiting list. So you can understand how difficult it is to find a clinic that is having can accommodate you as soon as possible. We try to do our best, but even with that, because we are in an academic institution, we are dealing with issues like breaks like right now we are in a spring break. In August, we are closed almost for 3 weeks, and December we are also closed. So all these scheduling issues also delays treatment for some of our patients, and we have to consider that as well. So overall, with that explanation that I just gave you, what we try to do is to eliminate infection and inflammation, and of course, pain. So whatever we try to, the main goal of our therapy is going to be focused on this, because we have learned that these 2 factors are going to impact the quality or the way that you can heal. Any questions so far? No? So we are going to talk about the oral complications that are also associated with the cancer therapy. And this is going to depend on the aggressiveness or the protocol that you are having, the location, and the schedule of the drugs that you are going to take, and also the radiation administration. If you are having bone marrow transplantation, the age, the oral health status, and that's why it's important that we solve all the issues that you may have, and the radiation dose if it's over 6,000 centigrades. And of course, the other important factor is if we are going to be affected for other comorbidities, because if you have other conditions, let's call diabetes, or you have problems with the nutrients intake and you may have malnourishment, or if there are other factors like loneliness, depression, all these aspects are going to decrease the quality of life, and especially in some cases when the patient needs to lose multiple teeth, and they are going to affect the self-esteem, especially for you that are young adults. Self-esteem is very important, and if you miss, let's say, the front teeth, that is going to impact your self-esteem, because the way that you smile, the way that you talk, the way that you may have like a intimacy with your partners is also going to be affected, because some people feel embarrassed not to have the teeth. So hopefully we don't have to go there, but that may happen. And during the process, we want to make sure that you are comfortable, that you can eat properly, and that you can support this whole process with the less trauma, or the minimal detrimental effect on your life. So these oral complications are going to be mainly, like I mentioned before, the mucositis, the pain, You know, the pain, it could be the pain that you have in the muscles, pain that you have in the oral cavity. The TMJ also is going to be affected if you have infection. Remember that infections can be caused by bacterial, by fungal, by many other viral infection. And when you are receiving treatment, your immune system is depleted, making more easy to those, all easier to those infections to be present in your mouth. So you may be also in risk of bleeding, depending on the platelets level, if you have a splenectomy or other, like liver problems, etc. Dry mouth could be just the result of the affected salivary glands, or could be the part of the side effects of the medications. And if you have dry mouth, you are going to be more prone to have caries or cavities, and you are going to be also in more problem to have a periodontal disease as well. Some of these medications make you having a taste changes. And when you have taste changes, you don't feel eating, you know, food doesn't taste the same. So I have patients that they tell me, well, the food doesn't taste anything, so I just don't want to eat. And that is a very, very common side effect. And we have to find ways, and sometimes even if you don't want to eat, you need to make an extra effort, because malnutrition can make things even worse. Some of you may develop swallowing problems. And again, you have a therapy for that, and hopefully can be resolved sooner, because we have excellent swallowing therapists at USC. So hopefully you can be treated on time. And like I said, the tissue and the bone loss also can be another problem. And especially in the mouth, is going to be reflected with the missing teeth also, because the bone that holds the tooth is going to be reabsorbed in some cases, and teeth that may be very healthy become loose. And sometimes people say, oh, this tooth just came out and I never have any pain. So this is kind of the progress that these when we have salivary glands, they cause the dry mouth. They put us in risk to have a cervical caries in particular, because when the bone recedes, the root of the tooth get exposed, and the root doesn't have enamel. You know, the crown, that is the part of the tooth that we see, is covered, is protected by enamel. Enamel is one of the strongest tissues in the body, is the strongest, and is able to resist a lot of injuries. But acidity is not, and acidity is not one of them. And when we have dry mouth, also the pH, or meaning the acidity of our mouth, becomes worse. Sometimes we tend to have a lot of nausea and vomiting as a side effect of the medication, and that is also going to impact the cavities. I see a question here. Oh, okay. So no problem, Liam. Thank you. And that also is going to put you in risks to develop candidiasis, for instance. That is one of the fungal infections that some of you may present. And here, I have a graphic of some of the, we have several salivary glands. These are the major salivary glands, that is the parotid, the sublingual, and submaxillary. are the biggest, but we also have a lot of the what we call minor salivary glands that are, if you run your tongue against the tissue, you can feel like a little balls, and those are the minor salivary glands. We also have it in the palate, and when we have when these major salivary glands are affected, we must try to stimulate those minor salivary glands so that you can have enough saliva to be able to chew properly. These symptoms, like I mentioned at the beginning, they can be affected by depression, discouragement, that anorexia or lack of appetite, and also lack of sleep. Sometimes the pain may make you up, or maybe you are sweating too much during the night and you cannot sleep properly. So everything like a pitching a little bit in your overall discomfort. So how can we manage all these oral manifestations? With the mucositis, for instance, the most important part, and mucositis is when you have a lot of different inflammation in your oral cavity. You need to try to brush your teeth in a way that you are not causing any damage to it. Sometimes if you feel that the toothbrush is too hard, you can, before you start brushing your teeth, you can wet the toothbrush with hot water or warm water, and this is going to soften the bristles a little bit so you can clean easier. Make sure that you maintain lubrication of the oral cavity and the lips also. And there are some products that you can use for that, or sometimes simple water can do the effect. If you don't have problems retaining water, I advise you that you spray the mouth with water. If you can sip water, that's fine. If you cannot, just be sprayed with water. There are other products that are gels that can lubricate your mouth, but the lips also need to be lubricated. Chapsticks with UV protection are important because you don't want your lips to crack, because that become very, very painful. So keeping your lips constantly moisture, and you need to use those chapsticks not only once a day, but you have to use, depending on your needs, multiple times, but between 4, 5, or even more times per day. You need to relieve pain and inflammation, either with the prescriptions that they allowed you to take. Minimize the use of very flavored toothpaste, like for instance, cinnamon is very strong. So the less, the milder the toothpaste, the better. Avoid spicy or acidic food. Hard chips are very bad because they can break your mucosa, or toast also. If you are like to have a hot beverage, try not to drink very hot, so let them cold a little bit so that you don't cause any problems. Toothpaste that we recommend, well, the ones that are soft. Sometimes patients feel better with like a kid's toothpaste because they have less concentration of flavors. That could be an option. If you can tolerate the fluoride, our recommendation are the toothpaste that are high in content of fluoride, because they are going to prevent you from having a decay. So if you have a fluoride gel, the gel also will be better than the toothpaste. So that will be my recommendation if you are able to tolerate. Some people cannot. So it is depending on your tolerance. Swati. So that will be what we recommend. But some people tell me that they cannot. So lately, I have been recommending also even the toothpaste for kids, that they have less concentration of fluoride if you are not able to tolerate the prescribed toothpaste. So sometimes for mucositis, we also recommend bland rinses, and they are a mixture like from the typical warm salted water or salted water plus baking soda. That could be very, very, very useful, and it's something that is very, sounds like it doesn't have any signs, but helps a lot to relieve the discomfort that you have. There are topical anesthetics also, lidocaine 5%, or depending, even sometimes 20%, benzocaine 20%. There are some products that we can apply to the mucosa. The dentists have to recommend you depending on your. There are a lot of different products. You may have to take analgesics, like either if you can take NSAIDs, you will be recommended, or just Tylenol to relieve the pain. People who has high doses of radiation therapy and chemotherapy may benefit from growth factors like the palifermin. Cryotherapy, meaning something, even the simple ice chips can help you to release that pain. And the low level of laser therapy now, the lasers in dentistry are very friendly, and the dose that they have, the settings that they have, they also help to promote that healing faster. So they are also very, very good. And here I put a different scale of mucositis, because mucositis can go from 0 to 5. And so depending on how advanced this is, it requires more support, including parenteral support, like just to relieve the pain. And they can be, they can be life-threatening, because the pain is so severe that the patient cannot tolerate any solid or liquid diet. And we must take action on that. And of course, whenever you present any symptoms, that interprofessional collaboration is extremely important. We talk about bringing information from the oncologist, the nurse practitioner also is a very important team, because sometimes they know more than the oncologist about the PA, OT, PT. Like we talk about that swallowing therapy. So we have the nutritionist. Everybody needs to contribute to how are we going to modify the pharmacist. Anyway, and the social work, of course, or I'm not forgetting you. So social work is going to help you to access all the information that you need, the different providers, and of course, being part of group supports like this is extremely important, because you can come here and share your needs and your specific requirements. And if I don't have the answer for your problems, I will find it with any of my colleagues. So the most important, it seems like a careful oral hygiene can help you to prevent so many things from mouth sores to gum disease and caries disease. Because again, if we have that dry mouth, all these problems are going to be problematic. And recent studies shows that if you have a good oral hygiene, all the problems that I have mentioned can decrease significantly. So that's what we are going to try to achieve, having an excellent oral hygiene so that we minimize the problems. And of course, we are invaded by different products. So people will ask, what is better? Should I start using an electric toothbrush? Can I keep using my manual toothbrush? And the answer is whatever works better for you, whatever you feel more comfortable. And not only what you can feel more comfortable, but whatever you can you afford, because toothbrushes, electric toothbrushes, for instance, can go from $20 to $200. And that will depend on the way that you master your technique. Some people don't like the vibration of the toothbrushes or the ultrasonic toothbrushes. Some people cannot handle the weight of the toothbrushes. So sometimes, again, I go and I ask, okay, maybe you can try with a kid's toothbrush, because the kid's toothbrush, they are smaller, and maybe they are going to be easier for you to modify even, but maybe you don't want that because, you are a young adult and you don't want to be seen with a kid's toothbrush. So depending on you. And for me, even though I have been a dentist for more than 35 years, I like to do my manual. I enjoy doing I love brushing my teeth, and I do it with the manual toothbrush. So it depends. Even though I have electric toothbrush, I prefer my manual toothbrush. So it's whatever you feel more comfortable. And there are so many different pieces. Some people will say, oh, you have to use the Waterpik, you have to use your floss for sure. But there are many other devices that may be good for you to simplify your technique, but that is something that you and your dentist are going to discover. Are you having food impact in between teeth? It's not enough the floss. You need to use a small toothbrush. Whatever you need to use, take advantage. But don't feel that you need to have all of these devices to have a good oral. The only thing that you need is a toothbrush and your floss. And with the toothbrush, you can brush your tongue. If you don't have a tongue scraper, that will be okay. So, but try to master that part. There are many products that can help you. And we have toothpaste that is prescribed, like I said, and is this that is the 1.1, and is the one that is 5,000 parts per million. That's the one that you can use. There is the regular toothpaste that. So things are, all these products are here just as a general. I didn't put any specific brand. There is now a debate in if people should be using a fluor or not. And that is something that I wanted to discuss with you. Is anybody that is against of using fluoride in the group? Nope. I don't see any hands. Let's see. Everybody's using fluoride. Oh, I see someone here. No, okay. So recently it has been a debate about the use of fluoride or not. And what majority of the studies where they are discussing is the fluoridated water, because when you drink a lot of water, you don't know how much amount of fluoride you are drinking. But the fluoride that we as dentists manage is going to be topical. So the number one thing, if you have the habit of swallowing the toothpaste, do not continue doing that, because then we don't know how much fluoride you are intaking. So all fluor has been one of the best, public health tools that we have to prevent cavities. And thanks to fluoride, oral health has improved significantly, and meaning that majority of the peoples nowadays, especially here in California, in older adults, they have their teeth, their dentition. California is one of the states that has a higher number of a lower number of edentulous patients, and it's thanks to all the preventive measures. So I don't want you to feel that fluoride is not a good tool or a good treatment for your teeth, because fluor is the one that is preventing the cavities. And we have learned how important the teeth are, not only for that self-esteem that we talk, but to be able to chew, to be able to talk, to be able to deglute, to swallow your meals, etc. So you really want to keep those teeth as long as possible. And the products that we use, especially like, for instance, the varnish fluoride is a great tool. You only need to have varnish, depending on your needs, every 3 or 6 months, and it's something that is going to be there, and you just need to try not to swallow those products. The water is really the only product that is problematic, because we don't know how much we are drinking. But there are other products that are varnished that are based on chlorhexidine. And they are also effective. There are other that is chlorhexidine with thymol that is also going to prevent caries, but you do have to go to the dentist. There is a calcium phosphate toothpaste that is also very good, and now they are doing that. That is another good option for those who don't want to use fluoride. Recent studies have shown that the toothpaste that is calcium phosphate is as effective as fluoridated toothpaste. There are other things that for salivary treatment. There is one spray that I am recently used that is called Salivea. It's a very good product, and this product has enzymes. They have about 4 different salivary enzymes, and it's very, very good. There are also all the products that from Biotin that you probably are aware, but this is my latest discovery, and I am very happy, and the patients are also very happy with this product. And we talk about the importance of the nutritional counseling, and if you are snacking frequently, try to do it only 3 times a day. Try to have vegetables snacks if it's possible for your mucosa. Now there are a lot of different dips and hummus that are vegetable based. That's another option. Of course, you don't have to eat the chips, because remember, the chips may hurt you. If you have a high diet in carbs, try to increase the vegetables. Try to avoid processed food, and try to avoid high sugar diet. I am not a friend of sweeteners. I think that we do better not using them. I eliminated sugar in my coffee, I think 40 years ago, 42 years ago. So it's something that maybe I was 18 when I had to stop using sugar, and it was hard, but I did it. So you can do it as well. And here are some of the oral hygiene issues. If you are having trouble holding the toothbrush, or if it's hard for you to raise your arms. Bring all these issues to your dentist. Limit the smoking, the alcohol, or any other drugs habits that you may have, and everything will be better. Anti-inflammatory food is very good for you, and probably you, at this point, you are more knowledgeable than me, because this is going to help also with your recovery. So all those products that are high in omega-3 fatty acids, like salmon, tuna, sardines, canola oil, nuts, berries are also very good, stone fruit, apples, persimmons, pomegranate, and prebiotics like asparagus, artichokes, banana, chicory, probiotics also. And there is a lot of new information about the microbiota in our gut and also in the oral cavity. And we want to promote that with yogurt, cottage cheese, or any of the polyphenols like coffee, tea, and dark chocolate. They are also very good anti-inflammatory. Here I have some examples that you can see of the products that, instead having charcuterie boards, try to have vegetable sliced with hummus. Instead French fries, try baked sweet potatoes, etc. So there are other options that are healthier and are going to help our nutrition and prevent malnutrition. So I think that's it. If you have any questions, any more questions, let me know. Dr. Dinser, if you want to add anything, please feel free. I did a very quick review, and I hope that was of use to you. And